The views and opinions expressed by the following program and its participants are solely their current opinions and do not reflect the opinions of BOBO 89.1 FM and DMS Broadcasting respective stations. The program participants' opinions are based upon information they consider reliable and based on their knowledge.
At the Health Services Authority, we want to keep you informed about the latest developments that impact your health because your health matters to us. Join us each Friday and Saturday from 1 to 2 p.m. as we cover health news, offer advice, and answer your questions on Healthcare Today with HSA.
Welcome to another episode of Healthcare Today with the HSA. I'm your host, Chuck Taylor. Thank you so much for tuning in. Each and every Friday and Saturday, we get together at 1 p.m. and we talk about all things related to your health. And this time, we're talking about something I think has affected literally someone on this island in literally every capacity, talking about what is cancer. And I have some wonderful friends in here. They're no strangers to the radio, but once again, just go ahead and introduce yourselves for a listening public.
Well, hi, thanks for having us. I'm Dr. Danielle Smelly, and I'm one of the oncologists at HSA.
My name's Amanda Nicholson, and I am the cancer registrar at the HSA.
So let's just get started. If I've been under a rock and I've never heard the term cancer, what is cancer? And I know it's a large generic, but tell me what is cancer and how it breaks down, especially to our island.
So I like to define cancer as an abnormal growth that's capable of invading the body and spreading to other organs and causing those organs to malfunction. And if enough of your organs malfunction, well, we know what happens. But that's essentially it. It's an abnormal growth that has the ability to invade and to spread in the body.
Exactly. And so, I mean, they've used other terminology, very clinical, malignant tumors and neoplasma. But basically, it breaks down to exactly what you said, abnormal, affecting body parts. And so when they say, oh, I have cancer of the lungs, I have cancer, it's really that it just attacked that specific part or...
So we're not sophisticated in cancer. We just name the cancer after the body part it starts in. So if it starts in your lung, then it's a lung cancer. If it starts in your breast, it's a breast cancer. If it starts in your colon, it's a colon cancer. That's essentially the system. But the mechanisms are still the same, where there is abnormal growth, invasion, and the ability to spread to other body parts and cause those organs to malfunction.
Exactly. So when people start talking about bloodstream lymphomic systems, it's really because it started to take I want to say significant toll on those types of, but it started in one specific area.
So blood cancers are a little bit different. They're a little special and a little fancy. Blood cancers tend to start where blood is made, which is your bone marrow. And so because they have such easy access to your blood vessels, they're kind of everywhere all at once. And they're a little bit different from the sort of traditional cancers like breast and colon. Lymphomas are also a little bit different because your lymph nodes are everywhere in your body and they're all connected. So they can start in particular lymph nodes and they may just stay in that area, or they may affect more lymph nodes throughout the body. So lymphoma and leukemia are sort of special cases and they don't follow the rules. But the ability to, the concept of multiplying and growing and causing organs to malfunction still applies.
Okay. I mean, folks, we're not talking about things that you haven't heard before. And so when I tell you that cancer is the leading cause of death worldwide, it's not surprising. But what I think people don't realize is that 1 in 6 deaths across the globe, and Miss Amanda, you can help me with that, 1 in 6 deaths across the globe is related to some sort of cancer. That's huge numbers that we're talking about.
Yeah, it is, absolutely. And it's so important that you take preventative efforts. That's really the key. Cancer doesn't have to be a death sentence. Get your screenings done, get in early. If you catch it right away, there's a really good chance you'll go back to having just a perfectly normal life at some point.
Exactly. And folks, some of the most common cancers, and I'll just call them out, and Doc, you can kind of help me with them. I would say kind of the media has talked about breast cancer over the years, more so than any other one. Most recently, I want to say due to the huge amounts of celebrities that have gotten and talked about it. What would be some of the other cancers that we would be talking about?
So globally, we talk a lot about breast cancer, lung cancer, prostate cancer, and colon cancer as kind of our top ones. But here in Cayman, our registry is really where we're going to get our data from to find out what we have here. So I think Amanda can kind of shed some light on, well, what do we know from our registry?
Exactly.
Okay. And just to clarify, it is a voluntary registry, so we're not capturing every instance of cancer that's diagnosed here. We rely on volunteers to provide us with that. But we've had a lot of volunteers, so we do have a bit of information. Presently, the most reported cancers for women are breast cancer, colon cancer, and cancers of the blood. And for men, the most reported are prostate cancer, cancers of the blood, and lung cancer. And breast cancer has consistently been the most reported cancer ever since we started capturing data. I think it accounts for about 1/3 of reported cases.
Okay. And do you find, and this has always been just a thought, being in the Caribbean, and do you find that more women are more ample to come out and talk about a cancer that they have versus a male, especially a West Indian male, at that point involved, because the information is voluntary and correct. So they have to give it to you. It's not like you can just get it from wherever.
No, we need their physical signature on a form before we can use the data for analysis. But you are spot on about more females registering. We've got about 65% of our registrants are female, and I think you're right. I think that for whatever reason, women just seem to be a little bit more willing to share that sort of information.
And folks, and as the doc said, prostate cancer is definitely on the rise. And when I say on the rise, being reported more, because it's always been there, but now we're actually starting to get some numbers. People are actually starting to have that conversation saying, hey, you really need to go get screened. You need to take a look at, because being West Indian myself, I've grown up with several family members who, if you ask them if they had, seen a doctor, they'll tell you it's been years. I'm not in any pain. Why would I? And this is, folks, bear with me. I'm not creating drama, but I'm just saying the fact that people have said, I'm not in pain, I'm not sick, why would I go see a doctor? That's not a correct way to look at it. Would you say, Doc?
I mean, what I would say is that if you can get screened for your illnesses, then we can actually catch your disease before it's causing any problems at all. And we can hopefully treat it before it causes any problems. And that's a lot easier for everyone. It's easier to treat. It's cheaper to treat. It takes less time to treat. So I really think that, what we should encourage people who do not have any pain and don't think they need to go to the doctor to do is to do their age-appropriate screening. That's the thing.
Exactly. And this is a great segue, I think, for people to understand that, screening isn't every year. Sometimes it's 2 times in 5 years. Sometimes it could be once every 2 years. So what we're talking about isn't something that you have to do every year, but you need to, as the doc said, to do it appropriately depending on your age, your demographic, and also kind of your background history. I think a lot of us don't take a look at our family history or know enough of a family history to know, you may be predisposed to something. And Miss Amanda, you could tell me a little bit about that. And Doc, also, if you can chime in, how important is historical records for a family?
I think it's very important because your genetics and your family history might be an indication of whether or not you are at risk for certain diseases, not just cancer, but other things as well.
Absolutely. I mean, when we talk about risk factors for cancer, you will often hear us split them into modifiable and non-modifiable risk factors. So non-modifiable are things you can't do anything about. You will get older, and getting older is a risk factor. You have a family history that you cannot change, and that's going to be a risk factor because that influences your genetics, which ultimately you can't change. So you need to know, what are the things that I can't control, and therefore, how are they going to put me at risk? And what else can I do to modify that risk in my life in terms of the choices I make with my diet, my alcohol intake, my choice to smoke or not smoke. Don't smoke, guys. Nobody smoke.
No.
We don't advocate smoking.
We're going to talk about that in just a moment.
But that's exactly what knowing your family history is about. It's about figuring out where you fall on the spectrum of risk so that you know what steps to take to lower the chance that you'll get cancer.
Okay. I think this is a good time for us to take our first break. You're listening to Healthcare Today with the HSA. I'm your host, Chuck Taylor, and we're talking, I didn't really allude to it, but we're talking about World Cancer Day. We're going to talk about the actual day and leading up to it right here. This is BOBO 89.1 FM. We'll be right back.
Now back to Healthcare Today with HSA and our host, Chuck Taylor.
And we are back, folks. Welcome to Healthcare Today with the HSA. I'm your host, Chuck Taylor. And each and every Friday and Saturday at 1 p.m., we get together and talk about all things related to your health. And I have to tell you, as we enter into the month of February, there's a big special day that's coming up that we really need to take, I want to say, a look at it, because it's about not just the day, but it's about living the whole year with it. But you have to pick a day, so we're going to talk about that. But Dr. Smelly, just had mentioned about one thing I think that we really need to take a massive look at within our region when it comes to cancer is the body use. And when I say the body use, we're talking about what you put into it, what you take out of it, and also, folks, and I hate to say this, don't smoke. That is I want to say one of the primary, but the doc can back me up on that. And alcohol consumption, these are high triggers for cancer and just bad health and bad practice in general. So talk to me a little bit about that, Doc, when it comes to the smoking factor and the alcohol factor with just health.
So the things you can control are what we call your modifiable risk factors. So these are things that you can do the best to make the best choices for to lower your cancer risk. Diet, exercise are two of the major ones. There's no real need for me to talk about smoking because nobody should smoke.
Right.
There's no version of smoking that's good for you. Mm-hmm. So nobody should smoke. But when it comes to diet, we always advocate for a healthy, balanced diet. There aren't any particular foods where we're going to say don't eat that or don't eat that, because it's not about the individual foods themselves. It's about how you balance that with your fruit and vegetable intake, making sure that you are moving, that you're getting up, that you're exercising 4 times a week for at least 45 minutes, some kind of cardiovascular exercise, walking, swimming, it doesn't matter. You just have to get up and move.
Moving is key.
Moving's very, very important. But it's about recognizing that what you put into your body is going to influence your overall health. It's not necessarily going to 100% stop you from getting cancer, but it is going to, 1, lower your cancer risk, and 2, if you do unfortunately develop cancer anyway, because some people are genetically predisposed, you will be healthier and in a better state to deal with your treatment, right? And being healthy enough for treatment is a real thing. If you're too sick for other reasons, you may not be able to withstand treatment. So being healthy is important for lots of reasons.
You know what? It's I wouldn't say funny, but it's almost unheard of that I need to be healthy while I'm sick. Because I'm sick, I need to be healthy to be able to take certain treatments. So despite me being sick, I do need to be able to be mobile. I do need to have some sort of level, some sort of base for me to be able to take that treatment to help me get better.
Yeah, you do.
Folks, I hope you're listening to me. So if you get sick, it's better that you're in the best shape to be sick.
Correct.
And you may laugh and say, what's Chuck? I'm saying that if I'm going to be sick, I need to be in a healthier state than be sitting on the couch, eating whatever, drinking whatever, not moving whatever, and then I got sick. God forbid. I can't take certain medication because I don't have the health standard to do that.
Correct.
Wow. Folks, please take a listen to what we're saying. This could be directly related to saving your life, and I think it is important. Now let's back up a little bit. You talked about vegetable and low food and physical activity. I would be amiss if I didn't talk about alcohol and tobacco. Let's start a little bit with the alcohol consumption, just so people are aware that too much is too much.
So no one's gonna like this, The WHO actually classifies alcohol as a carcinogen. It's classified as a cancer-causing substance. So if you are trying to avoid getting cancer, you should avoid alcohol as much as you can. But life is for living. I'm not trying to rain on anyone's parade. So certainly, if you do insist on including alcohol as a part of your diet, moderation is key.
Okay.
That's going to be the standard. And moderation looks different because people have different tolerances, but moderation is really the name of the game. Maybe if you're going to have a drink every day, you have to be careful about the size of that drink. How much wine are you going to have? You're just going to have one glass with your dinner? Sure, but you're not going to have an entire bottle. That's too much.
Right. And I think, people have to understand certain, and folks, once again, we're not raining on anyone's parade, but if you are a person who is easily affected by alcohol, why would you want to use it knowing that you're easily affected by it? I mean, it's at that point, folks, where we start talking about predisposed to abusive alcohol. Same way with drugs. Certain people, I've heard them say, I don't even look at it because I know it will lead me here.
Yep.
They have that indication. My father, my mother, some family member had this problem, struggled with alcohol. My family has had this. I'm not going to take. They make that conscious effort to do it. So being aware of these things, and I said, I did not know that the WHO had actually classified it as that. That's just another reason for people to kind of step back and take an evaluation. And of course, tobacco, I grew up in a time where tobacco was on TV. It was in newspaper. The coolest guy smoked, the coolest movies, the television series. It was almost, and I look back now because of my industry, and I realize it was a lot of placement product. They were paid to put this and paid to do that. And then I think, wow, you were paid to get cancer.
Yeah.
Back in the 60s and I think, how far we have come. And I still see some TV and some movies, and I see these, and I'm like, I pointed out to my children, I said, that's placement. They're like, oh, we noticed it, but we didn't notice it. I said, that's because it's that. It's no different than, a certain type of pop or whatever. You feel like, hey, that looks good, the coolest suit or whatever. But it's all about understanding so we're able not to fall into these pitfalls. And I think that is one of the things that we need to talk about. And World Cancer Day, tell me a little bit about that coming up, because that's what we're really alluding to. All the conversation that we're having is leading up to that, because I think it is important for us to recognize and also all the things that kind of go around that specific day.
Well, World Cancer Day was February 4th, but the HSA is taking the entire month of February to raise awareness about cancer. So while it was just one day, we're continuing on with it. Make the whole month about understanding how to prevent cancer and, like Dr. Smiley said, things you can do to keep from getting it in the first place. But World Cancer Day was started by the Union for International Cancer Control, and every year it's February 4th. The theme this year was called Close the Care Gap, and what that means is that we need for everyone to receive the necessary treatments that they need to get well. And the HSA held an event to recognize World Cancer Day. We had the event on the 1st of the month, and it was called The Holistic Approach to Oncology Management. And we had information booths, we had presentations, Dr. Smelly presented, there was a panel discussion, and I think we had such a good turnout, they had to bring in extra chairs. But I think it was a great opportunity to just educate people about what cancer is.
Exactly. And I think education is really the key. For far too long, we haven't had these types of conversations. So it was always, don't get it. But how do you not get it? How do you live your life and understand where you are and say, okay, you know what? I'm going to make better choices so that I won't fall into, as I said, this pitfall. And Doc, let me ask you this. Is every tumor life-threatening? Is every time, because people say, this tumor and it turned cancerous. Tell me a little bit about that if you can.
Sure. So I want to encourage everyone to although you may do the best you can with your risk factors, with your diet, with your exercise, that doesn't mean that you may not still eventually have to deal with this problem. And what I don't want people to take away from this is I did something bad or I did something wrong and I failed and this cancer is some kind of punishment. Sometimes you do everything you can do and it may still happen to you. You may still develop this issue. And ultimately, what we want you to do is to come in and let us help you, because not every cancer is terminal. Not every cancer is a death sentence. There's a lot of treatment that we can offer, particularly if we catch your cancer early. There's a lot that can be done to remove it, to lower the risk of it coming back, and to get you back to status quo and back to your life and, back to the way you were before this ever affected you. Right. So there's lots that can be done. And if it does ever happen to you, it's not your fault. So just know that the resources are there to help you get better.
I think that's really important that you say they need to understand it's not their fault.
It's not.
Because when I speak with cancer survivors, so many times I get the impression they're sort of embarrassed. And there's nothing to be embarrassed or ashamed about. If you had a heart attack or something, you probably wouldn't be embarrassed or feel like you were a bad person. But cancer's got this weird stigma about it.
I know. And I think that is the reason why we need to have these conversations. People, before it was almost a nasty word to say cancer.
Yeah.
I try to I talked to my children and I said, you know what? Coming up, cancer we never say cancer, it was the big K or say it was all these weird acronyms for something that most of the world was talking about.
Yeah.
And having real conversations about what it is, how to treatment, what does that treatment consist of? What is benign? What is malignant? So people, as you have these talks, they become more educated and not afraid of it to say, hey, if I did get it, I'm not going to sit down and let it consume me or think I did something wrong, and not bringing religion into it, like God punished me for this or the family willed this to me and, I was a bad, evil person. No, it has nothing to do with anything of that nature. And I think the mental part of it, that mental anguish, helps with that spiral, because people always say, if you think that you are sick and you'll never get better. You don't want to go see the doctor. You don't want to, because you're thinking in your mind that I don't want to do this. I'm just going to let my life. No, we got to take responsibility for it. And honestly, be happy that we're continuing with our medicine treatments, because today the world of medicine is so fascinating. We are in leaps and bounds beyond what it was, just a few years ago. So life expectancy has turned on a positive swing once it's caught in time, once it's treated, and once you understand how to continue living with it. And I know I'm getting off on a little tirade, but talk to me about the tumor situation, Doc. We started on that, about malignant, what benign is, and in precancerous, is it?
Okay, so I'm going to use breast cancer as an example, because I think breast cancer is a good representation of something that has very sort of clear phases. What we don't know for a lot of cancers is when does it actually start? And so there are a lot of conditions that we can't screen for because we don't know what it looks like before it actually becomes invasive. Breast cancer is a good example of a condition that has a very clear precancerous form. When we say precancerous, what we mean is that there's a way to detect breast cancer before it becomes invasive, before it acquires the ability to invade the body and spread to other organs. And that's what we're looking for when you come in for your mammogram. We're looking for evidence that something has changed and that if we don't address it now, it can change even more and become invasive and become a danger to you. So breast cancer has a precancerous form where it's not going to invade the body. If left untreated, that can develop into an invasive or a cancerous form. And then if it does become cancerous, we then want to know what stage it is and how far into the body it has invaded in order to plan treatment properly.
Okay. We're going to take a quick break and come right back. And I'm going to ask our panel here about signs and symptoms of cancer. You can tell me of the different types and break that down for us. Also, if you are a cancer survivor or you are going through it, how you can help us by helping others. I'm going to talk to Miss Amanda about that, about the registry. So keep right here. This is a BOBO 89.1 FM. It's Healthcare Today with the HSA. I'm your host, Chuck Taylor. We'll be right back.
Now back to Healthcare Today with HSA and our host, Chuck Taylor.
Welcome back. It's Healthcare Today with the HSA. I'm your host, Chuck Taylor, and we're talking about a World Cancer Day that happened just a few days ago. It was on February 4th, but we at the HSA are celebrating it for the full month of February. They have different things planned, and also just having the conversation continue, because this is something that I think has touched a lot of people right here in the Cayman Islands. And if you could just go ahead and introduce yourself, our guest here today.
I'm Dr. Danielle Smelly. I'm one of the oncologists at the HSA.
I'm Amanda Nicholson. I'm the cancer registrar for the HSA.
And right before we ended, we were talking about signs and symptoms of cancer or pre-cancerous. So you can tell me a little bit about that, doctor. What can people think they know or think they feel? Or walk me through that.
So I think that first and foremost, we would ideally like you to be diagnosed before you have any signs or symptoms. So we strongly encourage everyone to do their screening tests, because that's when that's exactly what screening is. It's detecting a problem before there are signs and symptoms. Mm-hmm. Some signs and symptoms that may develop that can lead to a cancer diagnosis include an unusual swelling in a part of the body or an unusual lump that's growing and not going away. You may experience changes in appetite or significant weight loss over a period of time. It is possible to have pain in an affected body part, or there may be unusual bleeding, such as from when you pass stool, such as with colon cancer, there may be blood in the stool. So the signs and symptoms are incredibly varied. They really depend on the body part that is affected. But in general, altered appetite, weight loss, and just malaise are sort of the features that cancers tend to share across the board.
Mm-hmm. In this may sound like a very simple question, but is fatigue involved in that a lot? Fatigue
is such a complex symptom because it has such a varied amount of, so many things can cause fatigue.
Okay.
In younger women, so women who are 30 or 40, fatigue is equally likely to be from something like an autoimmune disorder like lupus as it is to be from potentially an early breast cancer.
Okay.
So it's very difficult to say that if you feel tired, you should suspect that you have cancer. That's, I think, a terrifying thing to tell people.
Yeah.
But fatigue can be very significant in patients that do have a diagnosis of cancer.
Okay.
But it doesn't mean if you're tired, you might just also need some vacation from work.
Yeah, I was just about to say that. Rule of thumb is always, I mean, and people may laugh, there should be 3 people that you should have outside of your mom, dad, your priest, all of that stuff. You should have a good doctor that you can rely on to have a conversation with all the time about things like this. Something that, there may be a reason, there may not be a reason, but at least you're having that conversation in early mode. It could be, hey, you're not sleeping good. Why are you not sleeping good? Could be work-related, could be stress-related. If they do the blood work and they see something, then you start the process of figuring out. It's almost like a detective. You have to start to know what you're looking for. But if you don't know what you're looking for, at least have some pertinent questions that they can answer and go from that. One of the things I always ask, how can you think, and folks, once again, we're a show that we talk about real life. So hepatitis B, other things, what is it? HPV, how do you pronounce that?
Human papillomavirus.
Human papillomavirus. Talk to me a little bit about that. Those things are now coming into wordplay and understanding. What are they and how do they relate to cancer?
So HPV, or human papillomavirus, is the virus that causes cervical cancer. And it's a good thing and a bad thing in the sense that cervical cancer now is one of the very few cancers where we can say, well, we know why this happened. and we know how HPV is transmitted from person to person, and we have a vaccine that can prevent it. We have a vaccine that can help the body get rid of HPV so that it does not stick around long enough to generate a cancer. And HPV is not only associated with cervical cancer, it can be associated with other types of cancer that affect both men and women. So vaccination across the board is actually a really positive thing because it can reduce HPV levels in a community and therefore reduce the incidence of cancer.
See, and that's strange because when I and once again, a little information can be dangerous, so try to get the full understanding of it. I thought it was only female-related HPV. I didn't know that it was also for both sexes based off of that.
Oh, absolutely. There are absolutely male cancers that can be associated with HPV. And so, but also, women don't get HPV from the supermarket.
Right.
They get it from men.
Right, exactly.
So that sexual contact is what helps the HPV spread throughout a community. So if everyone is vaccinated, then it reduces the ability of HPV to be able to move from person to person.
Exactly.
So you protect your women.
It's not a traveling, right. You can kind of reduce it by kind of herd contact.
Correct.
By reducing
exactly
it that
what
way.
we were talking about with COVID. It's about protecting everybody. So if everyone gets vaccinated, then everyone gets protected, which is great.
Excellent. And speaking about everyone, Miss Amanda, let me just turn the table a little bit and talk about if someone is listening out there and they have walked this walk, been through this journey, and they want to help someone else or even help because folks, when we talk about the registry, this is key for public consultation. This is key for knowing how much medicine we need. It's key in helping policy right here in the Cayman Islands. Tell me a little bit about that.
Well, the goal of the cancer registry is to better understand what cancer trends look like in the Cayman Islands. You need a basis of information, just basic information, if you're going to plan for cancer prevention and cancer management efforts. And at the cancer registry, anyone who wants to volunteer, they're providing that information. They're helping us do everything possible to beat this disease. And the information that we gather is really simple stuff. You don't need to get your medical record or anything like that. It's mostly demographic. It only takes a couple of minutes to register. And it's important to note that it is confidential. No one outside of the registry ever sees the information. And if any cancer survivors who are listening want more information, or if they want to go ahead and register, they can contact me at 244-2560. There are also data collection forms to look at or print off on the HSA's website, Breast Cancer Foundation's website, and the Cancer Society's website.
And this is something that is updated, or how does it work? Once you put the information in, where does it go?
That's a good question. Once we have the data collection form filled out, the information is entered into a database, which was actually designed by the World Health Organization, specifically for storing cancer surveillance data. And when we put the information in, we don't use the registrant's name. They're automatically assigned an 8-digit code number.
8 digits, wow.
Yeah.
Okay.
But most of the information that goes in coded. And I'm the only one that has access to it. It would take 3 different passwords to access the information. And if you did access it, you're probably not going to understand what you're looking at unless you... Anyway, it's confidential.
Right.
We keep it safe.
Yeah. Yes, exactly. And that's really good to know because, a lot of people are always, in this date and age when data is, kind of king with it. People, they're very, I would say, fearful of it leaking out there.
Absolutely.
This is double, triple, quadruple protection. It's a lot of tiers of security so that this information stays where it stays and does what it's supposed to do.
Yes, and when we provide information to medical professionals or researchers, obviously we're not giving the registrants names. It's aggregate data. We'll say something like 35% of our registrants had breast cancer, or 18% of males had prostate cancer. But we're not giving identifiable data, yeah.
Exactly. And I think that is good to know. And also it reassures the public. I want to make sure that, that they understand that this is helping our community. This is helping policy. This is helping with in I don't want to sound crass, but this is helping knowing how much buildings that we need to house people that may have cancer, that need to help, and so we need to be mindful of this, that this is a building process and very numerical in its contingency to help us right here in the Cayman Islands. We're going to take another quick break and come right back, and when we come back, we will talk about cancer staging and also how the HSA is managing and what they're planning to do in the future. We'll talk about that coming up in just a little bit. This is Healthcare Today with the HSA. I'm your host, Chuck Taylor. We're going to take 2 minutes and be right back.
Now back to Healthcare Today with HSA and our host, Chuck Taylor.
And we are back, folks. Welcome to another episode of Healthcare Today with the HSA, talking about World Cancer Day and all the things that the HSA is doing over there. And they've decided that this whole month they will be talking about world cancer and locally also what it means right here in the CI. And I have with me here my guest, Dr. Smelly, and also Miss Amanda. And I wanted to ask you, Doc, about different methods of managing and treating cancer. I want to say that we are closer to eradicating it, but I would be amiss to say that. So I would just talk about treatment and management of it. I hope in my lifetime I can, walk down Broadway and wave a craft saying that we have a cure. But until then, how do we do it?
It's actually a really exciting time to be an oncologist because I have so many tools at my disposal to help treat people with cancer. So as a medical oncologist, I use medication to treat cancer as versus the surgeons who will operate, or someone who does radiation oncology and they will use radiation. When we're talking about medicine, a lot of people immediately think of chemotherapy. And chemotherapy remains very, very important in terms of the arsenal of things that we use for cancer treatment, but it is not the only thing that we can use. There are certain cancers that will respond to what we call hormonal therapy, which usually takes the form of tablets that will interfere with normal hormones that your body produces to stop them from stimulating a cancer. There's also immunotherapy, which is medication that's geared towards allowing your body's immune system to recognize a cancer and kill it. And there's also, we are in the sort of advent of targeted therapy, where certain cancers, and I think lung cancer is probably the best example of this recently, certain cancers are driven by particular mutations that we can test for. And if there is a mutation present, there is a medication we can give that targets that specific mutation to turn it off. Wow. And when we turn it off, the cancer can't survive. It can't continue to divide. And I've had patients and I've had friends who've had cancer who have had remarkable results with targeted therapy. And when I say remarkable, I mean they go from having a tumor taking up the entire side of one lung to not being visible on scans at all.
Wow. That's really amazing.
Very exciting.
And I think that's and I want to say, in all honesty, goes back to the understanding of what we're taking a look at. We're figuring out that there's just not one way of taking a look at something. Let's look at it from the left side. Let's look at it from the right side. Let's turn it upside down and take a look at it. Let's think outside the box, because for many moons, everything was, and folks, once again, it was, go into surgery, cut, and you spend 2 years trying to recover because the body wasn't strong enough to do, these types of things. So there are other ways to approach it and just trying to figure out which one is the best for it to move forward. I think that's really good. We talked about, you said radiotherapy, is it?
Yep.
Radiotherapy. What exactly is radiotherapy?
So radiotherapy uses special machines that are capable of generating particular frequencies of energy. I guess is how I would explain radiation. But essentially, it's energy at a particular frequency targeted to the area where the cancer is, with the goal of killing those cells.
Oh, okay. I mean, most of us has heard of chemotherapy at some point in time. Lymphoma, leukemia. Those have been some that I've heard. They have in the U.S. They have full hospitals dedicated to that stuff that they've talked about. You said immunotherapy also?
Immunotherapy, yep. So your immune system knows you have cancer. Your body's not doing nothing. Just because there is a lump there that we can see on a CT scan or that we might be able to feel when we examine you doesn't mean your body has not started trying to deal with the problem. And your immune system tries its best to fight the cancer. It tries its best to get rid of those abnormal cells because your immune system knows that these cells mean you harm. But cancers are smart, and cancers are capable of making chemicals that stop your immune system from working effectively. And so when you look at it under the microscope, you can actually see your immune system cells in the mix with the cancer cells, but they're kind of stuck and they're not able to actually kill the cancer cells that are in front of them. So what immunotherapy does is it blocks the chemicals that the cancer produces, it blocks them and allows your immune system to actually have a full response and kill those cancer cells. So immunotherapy is really exciting.
Wow.
And it's been working for diseases that are traditionally not very responsive to chemotherapy. So things like melanoma or relapsed leukemia. Immunotherapy has come in and we've gotten just incredible results using it.
Wow. The science of it sounds exciting, but at the end of the day, folks, we're really talking about life here. We're talking about people, you know, who have in the past, and I'm not saying crass, but in the past, they were given days or time. You know, when I say time, you get your affairs in order types of conversation. We don't give into that very much anymore. There's treatment, there's hope, there's an understanding that something can be done on the positive side. You just have to catch it early, and that's why I think screening is so important. Survivorship. Let's talk a little bit about that. When we focus on survivorship, not only giving information for the registry is that, but talk to me about health and just the psychology about it, Doc.
So more and more, we like to emphasize that our approach to cancer is a holistic one.
Yeah.
Our goal is not just to give you medication and send you on your way. Our goal is to return you to your family, return you to your loved ones, and return you to your life, not just better because you got medication, but feeling like you have been adequately supported throughout your journey with cancer. So you don't just see us when you come to HSA. You don't just see the oncologists. You will see the psychologist. You'll see the nutritionist, your radiation doctors and your radiologists and your surgeons and myself and the nurses. We all collaborate together. Our pharmacist is very, very active and a participant in your care. And we also partner very frequently with the palliative care team over at Jasmine. And they are very, very important at providing quality of life. They are very, very important for our symptom management. And they play a really essential role in not just helping people get from the beginning to the end of their treatment, but maintaining their quality of life while they do. And so we're really grateful for them and the support that they give us and they give to our patients, because I can give you medication, but if that medication makes you feel sick, then that's where the team at Jasmine kind of come in and go, okay, well, we can help with the nausea. We can help with, the numbness that you're having to your fingers. We can help with the fact that you're not sleeping well. And so working as a team like that really helps us address everything that the patient is concerned about, not just the disease.
And I think that is so positive, because over the years we've realized that, it takes more emotional care. It takes more social care. Just having the backup. Sometimes people may not have a network that they can rely on. It's great to know that there's a network there that they can kind of tap into to help them as they move through this process, which is a daunting process to say the least. We were talking about, the side effects of it and things of that nature. And I think this is a question I want to ask for the registrar. Some of the current statistics, the current trends that we see cancer registry in Cayman. Can you give me a little bit of numbers and tell me a little bit about that?
The numbers that we have so far are kind of what you would expect. Breast cancer, colon cancer, prostate cancer, those are the ones that we're really seeing the most of. And recently, cancers of the blood seem to be seeing a lot of that as well. But it's important to have data specific to this population because it is so diverse. You know, it might not be the same here as it would be in the U.S. or other countries. So we really want to have our own data to understand what that picture of cancer looks like in Cayman. And speaking of statistics, we really need more men to register because we only have 35% of our registrants are men. So I encourage any male cancer survivors who are listening to consider giving us their information so that we can get a better picture of how it's impacting men in the community.
Exactly. And so if someone's listening now, how can they reach out to you and give you this information?
I'll give the phone number again. It's 244-2560. But if you go on the HSA's website, all of my contact information is on there, as well as the data collection form that we'll ask them to fill out.
Okay. And it's literally less than 5 minutes for you. Just real simple information. But it gets the information to the right source. Mm-hmm. And I think that is the key right there because, you know, a lot of us are very quietly going through treatment and we're, you know, if the family knows, then that's about it. We don't reach out to other people in the community who have walked this walk. And the great thing, I think, is that when we talk to people such as yourself who has helped so many others, we have a better understanding of, hey, there's a support group here for this. There's an avenue for information for this. Or you need to, you know, some people said, I can't eat certain foods when I'm on treatment. Well, here's an idea for you. At least it's somebody who's locally here that we can connect with. I think that is vitally important just for our community and peace of mind. As we roll through, before we take our next break and start wrapping up, what is the HSA doing for World Cancer Day and continuing throughout the month?
We had an event on February 1st at the Westin. I mentioned that a little bit earlier. But going forward, I think we're just going to promote cancer awareness. I know our marketing team is doing a great job on social media, sending those messages out there. And things in the community that people can do, you know, you can do things like volunteer for one of the nonprofits who are committed to preventing and fighting cancer, or go to social media, share your story of survival to encourage others to, you know, keep fighting and go forward. And, you know, take it as an opportunity to really think about getting your health screenings.
Exactly.
Yeah.
I think that is the key before we take our final break coming up here is, folks, if you haven't done your screening in the last, I would say, year to 18 months, you really, really need to go ahead and take a look at that because that could be key to survival for anybody. It doesn't matter who or what you are. You need to know what your baseline is so that you are able to react to anything that may come your way. I think that's a great way of putting it. We're going to take a quick break and come back, and I'll allow the ladies some wrap-up time. You're listening to Healthcare Today with the HSA. I'm your host, Chuck Taylor. We're going to be right back.
Now back to Healthcare Today with HSA and our host, Chuck Taylor.
Welcome to Healthcare Today with the HSA. I'm your host, Chuck Taylor, getting set to roll out of here in just a little bit. But I wanted to just remind you, we just celebrated World Cancer Day. I have with me Dr. Smelly and Miss Amanda here from the Cancer Registrar. And I wanted to just give them the platform to say, if there was something you wanted a person who has cancer or one who is just found out, or maybe somebody whose furthest thought is cancer, what would you say to my listening public?
Well, what I would like to leave people with is the notion that cancer is incredibly treatable. That, I think, is the most important thing. It's not a death sentence. There is something that we can do to help you. There's probably more that we can do to help you than you realize. And it's not a punishment. So don't think that you have to suffer. We don't support suffering around here.
Exactly.
Please come in. Let us help you.
Exactly.
And for any cancer survivors listening, I'm always happy to speak with you if you're thinking about registering or if you just want to learn more and get some information. But anytime a survivor provides us with information, it's getting us a little bit closer to being able to improve prevention and management efforts for this disease. And I should probably also specify that when we refer to a cancer survivor, we don't just mean someone who has beat the disease and no longer has it. If you have cancer or have had it and you're still alive, you're a survivor and you're eligible to register.
Exactly. I think that is the key. Folks, please take care of yourself each and every time we get together. I remind you about that. And also, if you know someone who is a survivor who may not be listening to here, have a conversation with them. Tell them about what we talked about today. And I think most people, under the right idea of what it is that we do here, will be more than willing to come on board and help. And also, reach out to any nonprofits. You know, they're a great source of information, a wealth of health, and also a peace of mind. You know, it's great to be social, and you will meet a friend, guaranteed. Thank you, ladies, so much for stopping by here.
Thank you for having us.
Thank you so much. Keep it right here. This is Healthcare Today with the HSA. Don't forget, you can tune in each and every Friday at 1 p.m. and Saturday, the rebroadcast at 1 p.m. right here on BOBO 89.1 FM. Take care and be good to yourself and have a good weekend.